Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Hello, and welcome to the Health Advocates. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help make informed decisions to live your best life. It's the dog days of summer, and there's a lot happening in the world of public health. Today, we're taking a broader look at the state of public health overall in the United States. Several stories have emerged at the same time this summer. The country has reached its highest measles case count in decades. Federal officials continue to investigate a major outbreak of illness connected to potentially lettuce or some other vegetable. Millions of eggs have fallen under a salmonella recall. COVID-19 activity remains relatively low, but signs point to an upward trend in parts of the country. And wildfire smoke continues to create questions for people with chronic health conditions. Plus, Anthony Fauci has been hauled to Capitol Hill to testify, and he invoked the Fifth Amendment 11 times. We won't cover all that today, but we'll cover some of what is relevant to our community. The stories may sound unrelated, but they share something important. Public health works best when it prevents the emergency that never happens. The child who never develops measles, the contaminated food that never reaches someone's kitchen, the infection caught before it spreads through a family, the person with asthma who receives enough warning to avoid dangerous smoke. When those protections weaken, patients and families pay the price. So today, we will talk about what these warning signs mean, what people can do now, and why the news does not give us only reasons for concern. It also gives us examples of what sustained public health work can accomplish. Let's start with measles. As of July 23rd, the CDC has confirmed over 2,300 measles cases in the United States this year. That already exceeds the total for all of 2025, and we still have several months left to go in the year. The CDC has identified 35 outbreaks this year, and 93% of confirmed cases have connections to an outbreak. In other words, we're not simply seeing scattered infections throughout the country. We're seeing measles find communities where enough people lack immunity for the virus to continue spreading. Measles spreads with extraordinary efficiency. The virus can remain infectious after an infected person leaves a room. Early symptoms often resemble other respiratory illnesses: fever, cough, runny nose, red, watery eyes. A rash generally follows a few days later. That creates a difficult problem. Someone can expose other people before anyone recognizes the illness as measles. And measles is not simply an uncomfortable childhood rash. It can cause pneumonia, inflammation of the brain, hearing loss, hospitalization, death. People who avoid these outcomes may still miss school or work, face medical expenses, or place medically vulnerable family members at risk. The country eliminated continuous measles transmission in 2000, 26 years ago. We achieved that through widespread vaccination and strong public health response systems. But national vaccination numbers have moved in the wrong direction. The CDC reports that MMR vaccination coverage among kindergarten students fell from over 95% during the 2019-2020 school year to under 93% during the 24-25 school year. That may not sound like a big difference, but those small percentage points do matter. They can hide much larger gaps within individual schools, neighborhoods, certain communities, or certain geographic areas. Measles does not need an entire country to lose immunity. It needs one sufficiently large pocket of people whom the virus can infect. Measles has also entered into our political arguments. Some people want to blame the current administration. Still others argue that the increase proves that vaccines do not work. None of those explanations capture what is actually happening. The people developing measles today often made their vaccination decisions many years ago. Declining confidence in vaccines did not begin with one president, one health secretary, or one election. At the same time, the decisions that government officials make today will influence what happens next year and several years from now. Public officials can strengthen vaccination programs, communicate honestly, support local health departments, and counter misinformation. Or they can undermine confidence and make the next outbreak more likely. The same distinction matters when people blame immigration or folks coming in from overseas. International travel does bring measles into the United States because the virus continues to circulate in many parts of the world. Any traveler can carry it. The more important question is what happens after the virus arrives. Travelers may introduce the measles virus to the United States, but gaps in immunity allow it to spread. The CDC identifies both increasing global measles activity and declining vaccination coverage as major contributors to the current situation. Turning a public health problem into a political accusation may feel satisfying, but it does not vaccinate a child, protect an immunocompromised adult, or help a school respond to an exposure. So what should parents and families do? First, check your vaccination records and your children's records. Do not rely on a vague memory of when you may have received a vaccine. Confirm it, particularly before international travel, or if you hear that measles is spreading in your community. Second, people who take immune-suppressing medications should speak to their healthcare professionals before receiving an MMR vaccine. MMR contains live, weakened viruses. Clinicians generally should not give it to people with severe immunosuppression. That answer can depend on the medication, dose, condition, and timing, so patients should not make that determination alone, but rather in conjunction with their medical provider. Third, act quickly after a possible exposure. People without evidence of immunity may qualify for an MMR vaccine within 72 hours of exposure or immune globulin within 6 days. A healthcare professional or health department should guide that decision. Finally, call before walking into your doctor's office, urgent care center, or emergency department when you suspect measles. Calling ahead allows the facility to isolate you and avoid exposing infants, pregnant people, immunocompromised patients, and healthcare workers in a waiting room. That one phone call can prevent a much larger chain of infection. Measles is not the only public health issue creating concern this summer. Federal officials have also investigated an unusually large number of illnesses caused by Cyclospora, a microscopic parasite that can contaminate food and water. One major outbreak has a connection we call to iceberg lettuce from Taylor Farms in Mexico. The FDA has identified illnesses in 9 states and traced many cases to shredded lettuce served at certain restaurants. The company also recalled market-side iceberg salad and shredded lettuce products sold at select Walmart locations around the country, along with lettuce distributed to food service customers in numerous states. Cyclospora commonly causes frequent diarrhea, abdominal cramps, bloating, nausea, loss of appetite, fatigue, and weight loss. The symptoms can continue for weeks. They may improve and then return. People with immune systems that are weaker may face greater risk of a severe or prolonged illness. Consumers don't necessarily need to avoid every piece of lettuce in America, or raspberries another potential cause, or cilantro another potential cause. They should look to the FDA's current recall information, identify the brand and the product, look at the date, discard any food that has been recalled. It sounds simple until you consider what the average person has to do. First, you have to learn about the recall. You must remember where you bought the food. You must find a code printed perhaps on a tiny package. And then you're probably going to want to do an excessive amount of washing of the lettuce itself. The best you can do is to listen to your local, state, and national health departments in trying to figure out the best way to navigate and how to care for yourself and your family. The FDA has also announced an investigation involving salmonella and recalled eggs. Midwest Poultry Services recalled certain white and brown cage-free eggs produced and distributed from farms in Texas. These are eggs that have sell-by dates that run from July 20th through August 17th of 2026. We'll include the FDA information in the episode notes because nobody should need to memorize such dates when listening to a podcast, but the key is certain eggs have been recalled in certain areas of Texas. Check your refrigerator, do not eat a recalled product, return it or throw it away, and clean surfaces that may have come into contact. Food surveillance often works quietly behind the scenes. Laboratory staff identify clusters, investigators interview patients, officials trace products through complicated supply chains. That work prevents illness, but only when agencies communicate the results quickly and clearly enough for people to act. You're listening to The Health Advocates. Please subscribe wherever you listen to podcasts and share this episode with someone who may benefit from it. At the Global Healthy Living Foundation, we work to help people living with chronic illness understand the policies, scientific developments, and public health decisions that affect their lives. Now back to the show. As of July 24th, the CDC has described national COVID-19 activity as low and relatively stable. Great news. However, the agency has identified early signs of increasing activity in the west and south of the United States. Separate CDC modeling has estimated that infections were growing or likely growing in 37 states as of July 22nd. The total level can remain low while the direction begins moving in an upward trend. Think of it like water at the bottom of a bathtub. The water may still be low at a low level, but once someone turns on the faucet, you start to pay attention to how fast it starts to rise. We're definitely not in a phase where we need to panic, but it's probably time to prepare a little bit. People at greater risk for severe COVID-19, such as those who are immunocompromised, should consider whether they have usable home tests, know whom to call after a positive result, and understand whether they may qualify for antiviral treatment. Timing matters. COVID-19 treatments work best when patients start them early. Waiting several days to contact a healthcare professional can narrow the available options. Travel, summer gatherings, crowded indoor spaces, increased exposure, as we all remember. So folks should make choices based on their own health risks and the risks of those around them. For one person, that may mean doing very little differently. For someone receiving chemotherapy, taking immune-suppressing medication, or caring for a medically fragile family member, it may mean using a high-quality mask in crowded settings, improving ventilation, or testing before a visit. The goal is not to make everyone follow one universal rule. I think we learned that. But the goal is to give people accurate information so each person can make informed decisions that match their circumstances. Speaking of COVID, an FDA advisory committee has recommended that the 26-27 COVID-19 vaccine target a newer JN1 lineage variant known as XFG. Manufacturers and regulators still need to complete the steps that turn that recommendation into available vaccines and clinical guidance. Eligibility and timing may also depend on age, medical conditions, prior vaccinations, and evolving federal recommendations. Patients with chronic conditions should discuss timing with a knowledgeable healthcare professional rather than assuming that everyone should follow the same schedule. Another question receiving a lot of attention this summer concerns wildfire smoke in home gardens. Can you eat vegetables that have had exposure to smoke or ash? For smoke from burning vegetation, ash and smoke generally do not penetrate intact fruits and vegetables deeply. Thoroughly rinsing produce under cool running water can remove much of the material on the surface. You should also wash your hands after handling ash-covered produce. Do not use soap or household detergent on fruits and vegetables. We've covered several concerning developments, but public health does not only consist of warnings. Researchers at Oxford have launched the world's first phase 1 trial of a vaccine designed to protect against the Ebola virus. The trial will evaluate safety and immune responses in 50 healthy adult volunteers. Researchers and manufacturers have also prepared investigational doses that could support a faster response if the vaccine proves successful. We've also received some encouraging news from El Salvador. The World Health Organization validated El Salvador as having eliminated trachoma as a public health problem. Trachoma can cause blindness and often affects communities with inadequate access to healthcare, clean water, and sanitation. El Salvador became the first country in Central America and the second in the Americas to reach this milestone. Excellent news. The achievement did not come from one dramatic breakthrough, but rather from sustained surveillance, targeted assessments, and the willingness to keep looking for cases even as the numbers declined. That represents the part of public health that we often talk about that rarely receives enough attention. Success does not always look like a heroic rescue. Sometimes it's just years of diligent work followed by the absence of a disease. The stories we discussed today revealed many different public health features. In one feature, vaccination rates decline, preventable diseases return, food recalls leave consumers confused, and people with chronic illness struggle to obtain clear guidance. In the other, scientists are developing new vaccines, countries eliminate diseases that once caused blindness, and health systems give people the information they need before a crisis reaches them. Neither future happens automatically. Public policy matters, scientific investment matters, trust matters, and individual choices matter. This week, consider taking 3 simple steps. Check your family's vaccination records, check your refrigerator for recalled foods, and update your personal plan for COVID-19 as we head into the fall season. Public health may feel invisible when it works. Those headlines show us both what happens when protection breaks down and what becomes possible when communities sustain it. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please like and subscribe and leave a comment down below. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.